What if every cancer patient had a plan for their health and not just a plan for their disease? What if you could change the trajectory of a cancer prognosis towards health for your patients? I'm Dr. Nalini Chilkov, the founder of the American Institute of Integrative Oncology. I've taught hundreds of frontline clinicians how to acquire the skills and knowledge to feel competent and confident meeting the needs of patients whose lives have been touched by cancer so that you can guide your patients towards creating and sustaining a body where cancer cannot thrive. I developed my research-supported OutSmart Cancer System over 35 years, caring for thousands of patients. This has been the most rewarding work of my lifetime. This started for me when both of my parents were diagnosed with cancer in their 50s. Ultimately, both of them lived another 40 years into their 90s, and neither died of cancer. Like many of you, I had no specialized training in oncology. I didn't know how to support or evaluate cancer patients or cancer survivors. It's my mission to continue to transform the face of cancer care by training clinicians like you so that you can provide clinically relevant, health-focused support for your patients using a collaborative, integrative medicine whole systems approach. After all, the word health does not enter the conversation in conventional oncology care, but this is ultimately what is most important to patients. A plan for health is a crucial missing element in cancer care today. Because 1 in 2 Americans will develop cancer in their lifetime, and there are 19 million cancer survivors in the US today, these patients are already in your practice. If only they knew you could help them. My self-paced, research-based, health-focused clinical online training program includes live mentoring, case supervision, and rich resources so that you can learn to master my OutSmart Cancer System and skillfully and confidently provide support for the health side of the cancer equation to millions of patients desperately looking for this kind of ongoing care. The need is immense and largely unmet. Let the oncologist be the disease expert. You can be the health expert and the go-to clinician in your community and build a waiting list practice like I have. In order to get started right away, I've created a free downloadable assessment and planning guide that will show you how to start taking a thorough and complete cancer history and compose the elements of a support plan that'll address unique needs of cancer patients and survivors in a highly individualized fashion. This will get you thinking differently about assessing patients with cancer history and cancer risk. I welcome you to join our community and become an integral part of providing health support to cancer patients and survivors. Click on the link below to receive your OutSmart Cancer clinical intake and planning guide so you can get started right away.